As you know, from time to time, the angulation of an implant is at an angle where you are not perpendicular to the occlusal plane. The anterior area has a 15-degree angle on it. The premolar area often has a 15-degree angle on it. And sometimes that implant comes out at an angle which is highly frustrating to you. Now, if it is actually perpendicular to the occlusal plane, as you know, in the last few years, we've gone from cementing a crown over an abutment to having a hole in both the crown and the abutment, so that when a screw comes loose, that screw can be taken out, replaced, screwed in properly, and go for another period of years. So that technique is very well known, and has been the most popular thing over the last several years, and I'm sure it will grow more. But what it's saying is, get the implant perpendicular to the occlusal plane. Now, many of you are doing implants right now. I've been placing implants for 30 years, one of the first ones in America. And I've become very accustomed to wanting to get that as perpendicular to the occlusal plane as possible. But does that happen? No. This case was sent in by a local practitioner, periodontist. And as you can see, they're off angle quite considerably. Can they be corrected and still function? You're seeing many of these so-called all-on-4 procedures now where they're putting them at a 45-degree angle. I disagree with that quite vehemently, but that's what somebody's idea is. Photoelastic stress shows different peculiar stresses not only on the bone, but also on the implant. Let's take this case, though. What can be done to salvage that case? Let's put the transfer copings on, and you'll look even more askew at it. Look at the transfer copings, upper right image. The laboratory technician has made some custom abutments, the middle image on the left. And you see the crowns, and then you see the final result, 13 years of service. Yes, it can be done, but that is far more complex and more difficult than I would really like to see. In recent years, not very long ago, out came little screwdrivers that can correct the screwdriver going into the screw on the coronal part of that implant up to 15 to 30 degrees of off angle. And most of the companies are now making these screwdrivers, which is the purpose of this little 5-minute discussion with you. Every company's a little bit different. I would suggest you look very seriously at having a screwdriver, and especially make sure that it fits the particular brand of implant you're using. As a prosthodontist, I get all kinds of implants coming in from places across the world that I don't even know what the implant is. There are about 500 brands of implants right now, so we don't really know. The one that we teach most in our own courses is the one you're observing there, and that is Implant Direct. That's the most popular implant among general dentists at the current time. And they've had a number of new advancements with it. This Smart Base is one of those off-angled screwdrivers that satisfies the need to screw through the coronal part of the implant and not require you to cut a hole in the facial surface or the incisal edge of that particular situation, which you see. So check with the company that you're using most often for implants and see if they have one of those screwdrivers. If not, some of the accessory companies also have screwdrivers that will go at that peculiar angle, and you need to have some of those in your armamentarium. Look seriously at getting one. Thanks for being with us. Join us next week.